Hi everybody, Dr. Daniel, and today I'm discussing a question which is, hopefully I'll answer it, is there a link between vestibular migraine and Meniere's syndrome? Well, vestibular comes from the word vestibule, which is a Latin word. It means an entrance hall, and it's inside the auditory canal, carries fibers that connect to the brainstem through the eighth nerve. And the vestibule has, along with the semicircular canals and the saccules, connections for rotational movement appreciation and also for linear acceleration. So it's like there's a little gyroscope in our inner ear that helps us with balance and coordination. Well, regarding connection between vertigo and migraine, neurology textbooks dating back to the last 50 years, all of them list a symptom of vertigo as being one of the common symptoms of migraine. I remember studying that when I was a medical student in the 60s. And since then, every year, there are many articles published in the ENT and the neurology literature on the relationship between migraine and vestibular symptoms. And finally, several years ago, the Brawny Association, the American Academy of Neurology, got together and defined what's called vestibular migraine. But before I get there, I want to talk about and define vertigo. Vertigo comes from the Latin and means to turn. And it's a symptom really of dizziness or rotational movement. I tell people it's kind of like you're on a merry-go-round as a child, and you get off and you feel this whirling movement kind of feeling. In the broadest sense, vertigo can mean any feeling, a perception of movement in the environment on the part of the patient. So any movement can do that. So sometimes it's like a swimming movement, or it's like a boat's movement, slight rotational movement, and things like that. Also, vertigo is discussed as being end organ in terms of the etiology where it comes from, and that means in the inner ear, in the vestibule, and semicircular canals, and connects through the eighth nerve to the brainstem, or central, where it is in the brainstem, the cerebellum, actually part of the brain itself. And I'm taught that something like 90% of vertigo comes from the end organ or the inner ear, and the other 10% comes from the brain. Now, dizziness has a broader and much vaguer kind of group of symptoms. Dizziness can be giddy, loss of balance, feeling like you're going to fall. It's like you're standing on the top of a ladder, feels lightheaded, near faintness. Those are symptoms people use. Unsteady, swimmy-headed, and there's a huge differential diagnosis, which I'm just going to read to you. It includes inner ear inflammation, hypoglycemia, an electrolyte imbalance, low blood pressure, decreased heart output, anemia, anxiety or panic disorder, hyperventilation, medication effect, or many other causes. Now, close questioning, most persons can, by giving a history to a doctor, differentiate between dizziness and vertigo. Vertigo has a strong, usually rotational type movement sensation. Another thing that links to migraine that is associated with the eighth nerve of the inner ear is motion sickness. Now, something like 60% of persons with migraine have motion sickness, and I'm a ex-Navy doctor during Vietnam at San Diego, the hospital there, and I saw persons who had motion sickness that had to be sent out of the Navy, very understandingly and for good reasons. To be fit for duty in the Navy on board ship, you have to be able to function, and persons with motion sickness usually can't function well. Also, motion sickness occurs in children. It may relate to the constant movement, fixation, refixation movements that the eye makes when you're in the car and you're bumping around looking on the inside of the car. If you're trying to read or do a puzzle, use your eyes, that makes it worse. And some persons who are adults with like migraine then have motion sickness are better if they drive the car because they are looking at the ground ahead, hopefully, when they're driving, and that doesn't move, so they don't get so many fixation movements of the eye. Or if you're riding shotgun on the right side of the car. All of the eye movements that adjust the eye connect to the brainstem with the vomit center together. Only 5 to 20% of persons who don't have migraine get motion sickness. Medical practices that specialize in migraine find that 27 to 42% of their patients report episodic vertigo, and about 30% of these migraineurs get vertigo when they have no headache at all. They just get a lot of dizziness. The converse is true in practices like ENT, ear, nose, throat, otology. If they specialize in vertigo, they have 16 to 32% of their patients have migraine. Now, let me define migraine a little bit. 70% of headache is tension type headache, and 30% about is migraine. And migraine is genetic and familial. The concept is you're born with it, can't cure it. It's in families. Migraine can be without aura or with aura, and the odds there are something like 60% of patients will have without aura, another 30-40% will have it with aura. The aura part of the headache will be usually a visual image of zigzag lines, seeing half of things, or spots that come into vision first before the headache starts, although it can come previous to the headache starting or during the headache or the end of the headache. But it's an aura, a visual aura, that patients usually are very well aware of, and they can draw it and you show them pictures of it. They'll say, yeah, that's what it looks like. And the aura usually lasts 10 or 20 minutes. Usually it's supposed to last less than 60 minutes. And sometimes the other part of the aura will be a numbness or tingling sensation that sweeps up the fingers in the hand, that goes to the face and tongue on one side of the body, or some trouble talking, difficulty talking, which is called aphasia, which again lasts usually minutes and goes away. Most persons who have migraine with aura just have the visual aura. And then the migraine with aura or the migraine without aura patients that also will have headaches that usually are one-sided, throbbing, or severe on a scale of 1 to 10. They're level 8, 9, 10. Or many patients will tell me 20, something like that, which is sad because it's a horrible problem. It's disabling. It's associated with nausea and vomiting. And migraine turns all your senses. So the eighth nerve is turned on, the hearing branch. And so they're very sensitive to sound. The ophthalmic branch, first cranial nerve, is turned on, so they're sensitive to odors. And then also the eyes and the retina are turned on, and so you have sensitive to light. So sensitive to light, sound, and odors are common migraine symptoms. And migraine can last from 4 to 72 hours. It usually comes in attacks, leaving the patient afterwards drained unless they are able to treat early on with medication and get rid of it early on. So this new entity of vestibular migraine is now in the International Classification of Headache, and the Bronny Association has recognized it. I'm just going to read their guidelines for definition. You're supposed to have 5 episodes fulfilling criteria of having past history of migraine, either with or without aura, although most persons who have the migraine with aura will have more vestibular symptoms. They have moderate to severe vestibular symptoms that last 5 minutes to 72 hours, because that's how long a migraine will last. And the headache will come with at least, you're going to have a headache with it, at least 2 of the following characteristics. I'm going to name those. There should be one-sided headache, throbbing, moderate or severe, aggravated by routine physical activity, sensitive to sound or light, a visual aura. And there's no better used term for this. Now in the past, this condition, vestibular migraine, has been called migraine-associated vertigo, dizziness, migraine-related vestibulopathy, or migrainous vertigo. Okay, next let's do vestibular symptoms that may come with this. So they should be spontaneous vertigo. It's a false sense of self-motion, or it's like you're moving at some degree. There's positional vertigo after change of head position. And usually the vertigo triggered by a complex law of moving visual stimulus. It can be head motion-induced vertigo occurring during head motion. Head motion-induced dizziness is called dizziness sensation of disturbed spatial orientation. There also may be, with this, symptoms of ringing in the ears. It's like a roaring, hissing, ringing in the ears. It's called tinnitus. They should be the episodic rotational vertigo, as I mentioned earlier. They should have a hearing loss, which is intermittent and may come in attacks. They may not come early on, of course, attacks. Like they're 20 and start with it, but not much hearing loss. But if they live with Meniere's syndrome for 20 years, they'll have a hearing loss, a sensory hearing loss. And usually with the attack, they have ear fullness. That's called aural fullness. The duration of the Meniere's attack symptoms is variable. About 30% of patients have episodes lasting just minutes. 30% have attacks for hours. Another 30% have attacks over several days. And remaining 10% have attacks lasting just seconds. But some persons, after a bad attack of Meniere's syndrome, can have symptoms lasting for a week or so, or several weeks. So back to the original question I posed at the beginning of this talk. Is there a link between vestibular migraine and Meniere's syndrome? Yes, Prosper Meniere wrote about it when he wrote about his syndrome of vestibular symptoms in the beginning. There's a long history of relationship between Meniere's syndrome and migraine in the literature. The 2018 International Classification of Headache Disorder states, overlap with Meniere's disease. Migraine is more common in patients with Meniere's disease than in healthy controls. Many patients with features of both Meniere's disease and vestibular migraine have been reported. In fact, migraine, Meniere's disease, can be inherited as a symptom cluster. Fluctuating hearing loss, tinnitus, oral pressure may occur in vestibular migraine, but hearing loss does not progress to profound sensory levels like it does with Meniere's syndrome. Similarly, migraine headaches, photophobia, and even migraine auras are common during Meniere's attacks. When the criteria for Meniere's disease are met, particularly hearing loss, as documented by audiometry, Meniere's disease should be diagnosed, even with migraine symptoms occurred during the vestibular. So, a little quiz here. Does vestibular migraine have hearing loss, ear fullness, or tinnitus? Not usually. Those are specific Meniere's disease type symptoms. How are these two neurological problems diagnosed? Well, the diagnosis is usually through a history neurological and otological exam. MRI scans the brain with migraine, and 30-40% show these little T2 dots that really don't mean anything as far as we know now. And Meniere's syndrome, it doesn't show a tumor of any sort that's affecting the eighth nerve or the cerebellum. And even if they're there, they usually are benign. An audiogram, if it's done, will show hearing loss, as mentioned before. So that's probably the main test that shows something abnormal with Meniere's disease. Prosper Meniere lived between 1799 and 1862, and he was a French doctor who first identified that the inner ear could be a source of a condition combining vertigo, hearing loss, and tinnitus. He thought there was a relationship and a link between the condition he described and migraine. Okay, well, what causes Meniere's disease? Well, no one really knows why. It's unknown, but the theory is an abnormality of a buildup of fluid inside of the inner ear. This syndrome is also called idiopathic endolymphatic hydrops. It means the vestibular system in the inner ear is thought to have abnormal fluctuations in the fluid called endolymph, and that comes and goes and causes these attacks. Again, it's not really well understood. What's the treatment for vestibular migraine? Well, vestibular migraine can be treated just like regular migraine. Nowadays, mainly triptans at the onset. You should do the migraine lifestyle. You can use typical old-timey drugs we used for migraine prevention, beta blockers, Depakote in men mainly, but not women, topiramate, and amitriptyline. And then there's data on that for being useful. This new CGRP drug, as far as I know at this time, don't have any known data on treatment of vestibular migraine, although one would think they probably would work. And then some persons who get nauseated could take Phenergan, promethazine, or transdermal scope patches, glycoprolate, and diuretics, which help relieve the dizziness-related vertigo. Some patients will take Diazide or Lasix for that. There's also used, and pretty successful use of benzodiazepine drugs for this, particularly diazepam, lorazepam, and then Zofran and Phenergan can also be used for the nausea. For the ENT doctors, They might usually say limiting dietary salt and taking diuretics will be helpful. There are claims that caffeine, chocolate, and alcohol aggravate these symptoms. CBT, which is a skill that helps people focus on how they react to illness, can be helpful. Some persons with really bad disease can get an injection of gentamicin as an antibiotic, which will destroy the 8th nerve, but of course you get death with that. Some persons are given cortisone with Medrol dose pack or a short dose of prednisone over a week or two. And then the bad, severe results of patients with severe Menieres syndromes will have surgery, which destroys the inner ear. There's some persons that doctors can do a draining shunt from the ear. There's a thing called vestibular neurectomy, a labyrinthectomy, which is surgical removal of the labyrinth. And again, 8th nerve section, neurectomy, labyrinthectomy, and transection of 8th nerve all result in permanent hearing loss, but it'll get rid of the vertigo, which has been so bad. So I hope that helps with discussing the issue. Is there a link between vestibular migraine and Menieres syndrome? There certainly is. Thank you very much for listening to this discussion. Please click on like and subscribe down there. Follow me on YouTube for other talks I have on migraine. God bless all you persons who have migraine and Menieres syndrome. And I'll see you again on the next talk.